to Blueprint Online Tuitions. Here at Blueprint Online Tuitions, we believe that having a strong foundation on the professional examinations gives the student an edge not only in his upcoming exams but also in his entrance examinations. So if you have any need with regards to your professional exams, you do need to check out Blueprint Online, and if you're already here, then you've made the right choice. I'm Dr. Vandana and welcome to Blueprint Online, and today I would like to take a class on the topic of ophthalmology. I would like to take a class on conjunctiva. Now, I want to start off with conjunctiva because I believe that with ophthalmology being a very volatile subject, we need to start off with an easier topic, and we need to make our understanding of the anatomy of the eye really strong before we jump into topics like that of cataract or retinopathy, because we need to know really a lot in detail about the anatomy of the eye to actually understand and to actually remember about these complex scenarios. Okay, so, and I would also suggest for you to think of real life scenarios of someone with conjunctivitis or someone with cataract, because these cases are pretty common, right? Okay, so I'll start off with conjunctiva, and the way in which I would explain all of my topics would be: first, I would explain about the anatomy, the relevant anatomy of the structures, because if you don't know what is right about an organ system, then it's going to be very difficult for you to figure out what's wrong. Okay, and then I would move on about the pathological conditions or the diseases. Then I would move on about the management, which is the investigations and the treatment. Okay, so the conjunctiva literally means to join. And what will this translucent membrane join? It's literally this translucent layer that covers the anterior aspect of the eye. Okay, whatever that is, now we have epithelial lining all over our body. Our respiratory tract has an epithelium. Our gastrointestinal tract has an epithelium. Our the ventricles of the brain have an epithelium. So if every part of the body is having a protective layer, even the eye, which is obviously a delicate structure, should have an epithelium, right? And yeah, it does, which is known as conjunctiva. And conveniently enough, it is translucent because we want light to pass through the conjunctiva. And yeah, so this conjunctiva joins what? So this conjunctiva joins two structures: the lid margin and the anterior aspect of the eye. Okay, I'll make things more clearer for you. Let's say this is the anterior aspect of the eye, and this is the lid margin, or this is the tarsus or the eyelid. And the conjunctiva joins the inferior aspect of the tarsus, that is the eyelid, till the limbus of the eyeball, and the limbus of the eyeball is where the sclera ends and the cornea begins, right? Okay, so this pink shaded structure over here is the conjunctiva. Now, broadly speaking, conjunctiva is actually divided into two structures, that is the palpebral conjunctiva and the bulbar conjunctiva. Simply speaking, the structure that is present over your eyeball is the bulbar conjunctiva, and the conjunctiva that is present beneath your eyelid is the palpebral conjunctiva. Now, the eyelid actually consists of different regions, right? So the eyelid consists of lid margin, and then the lid margin folds, and then it continues with the bulbar portion as the anterior portion of the eyeball, right? So the conjunctiva that is present at the lid margin is the marginal conjunctiva. Then this marginal conjunctiva then continues as the tarsal conjunctiva, that is as the inferior aspect of the eyelid. Then this tarsal conjunctiva then joins the eyeball as the orbital conjunctiva. Okay, and then there is a special connection between the palpebral conjunctiva and the bulbar conjunctiva, and these structures are known as the fornices. So I'm not going to go much in detail about the conjunctival fornices. It's just that they are the connective structures of the palpebral and the bulbar conjunctiva, and then we have superior, inferior, medial, and lateral fornices. Okay, and yeah, if I haven't mentioned it already, the bulbar conjunctiva ends in the limbus as a thick layer along with that of sclera. Okay, now this is about the gross anatomy of the conjunctiva. Now I'll move on to the histology of the conjunctiva. The conjunctiva consists of three layers. It consists of three layers, which include the epithelium layer and the adenoid layer and finally the fibrous layer. The outermost layer of the conjunctiva is the epithelium layer, and this epithelium layer consists of small goblet cells. About 20% of epithelium consists of goblet cells, which is responsible for the production of mucin. And the type of epithelium that we see in conjunctiva is non-keratinized squamous epithelium. Okay, and it is not a uniform layer in the sense it's not present as one or two layers throughout. At the margin it's about 5 layers, and it continues to be 2 layers near the fornix, and then later it again continues to be 5 layers when it's near the limbus. Okay, and then we have the second layer of the one more point is that the epithelial layer also consists of melanocytes. Right, now we'll move on to the second layer of the conjunctiva, which is the fibrous layer, the adenoid layer. The adenoid layer consists of lymphatic tissue actually. Okay, and so it consists of fine connective tissue. So let's say this is the epithelial layer, this is the adenoid layer, and more thicker and bigger is fibrous layer. So it consists of lymphoid aggregates, and it is present in what? It consists of two things actually. It consists of tissue reticulum, it consists of connective tissue, and in this connective tissue we have the lymphatic aggregates, and because of this lymphatic aggregates we have antigen antibody reactions and also inflammatory reactions are because of the lymphatics present in the adenoid layer, and follicular formation is also because of the adenoid layer. And one more interesting fact is that neonates and infants up to 3 to 4 months of life they actually don't have adenoid layer, which is why if they do have conjunctivitis then there's no follicular formation in them. That's an interesting fact. Then we have the fibrous layer. The fibrous layer, it's more thicker and consists of collagenous and elastic connective tissue, and this layer is where the blood vessels that supply the conjunctiva and the cornea exist. To supply the conjunctiva along with the nerves that also supply the conjunctiva exist. So the blood vessels and the nerves are present in the fibrous layer, and this fibrous layer blends along with the Tenon's capsule at the limbus of the eyeball. Okay, so now there's also a small point which is the plica semilunaris, which is present at the medianmost aspect of the conjunctiva, and it's actually a vestigial structure, and just medial to the plica semilunaris we have the caruncle, and this is a small pinkish mass, and this caruncle consists of whatever sweat glands or sebaceous glands and hair follicles. Okay, it's not really that important. Now the blood supply of conjunctiva Well, the blood supply of conjunctiva includes arteries, which see the okay. So I'll divide it like this. So we have palpebral conjunctiva. I'll write it down neatly actually. Okay. So when it comes to the blood supply of conjunctiva, the palpebral conjunctiva is actually supplied by the peripheral and marginal arterial arcades of the eyelid, and the bulbar conjunctiva is supplied by posterior and anterior conjunctival arteries. So the palpebral conjunctiva is supplied by the arterial arcade simply, and the bulbar conjunctiva is supplied by anterior and posterior conjunctival arteries. Now the venous supply is through the blood is drained through a venous plexus of the eyelids, which ultimately drains into the anterior ciliary veins. Now, one more thing about lymphatics. Actually the lymphatic layer is present in the adenoid layer, and it drains into the submandibular and the preauricular space for the lymph nodes. Okay, so if this is your eye and this, sorry, it's very clumsy, I'll make it a little neat. So if this is your eye, this is your nose, and this is your jaw, then your ear. So the lymphatics are going to drain into preauricular and submandibular zones. Okay, and when it comes to the nerve supply, actually the nerve supply near the cornea is through the long, when the conjunctiva is near the cornea, it is supplied by the long ciliary nerve, but when it is away from it, when the rest of the part is supplied by branches of lacrimal and intratrochlear and supratrochlear, many nerves, but the more important one is the one that is supplied near the cornea, which is the long ciliary nerve. Okay, right, so this is about the anatomy of the conjunctiva. Apart from that, the conjunctiva also consists of glands. It is a glandular structure, so it consists of two types of glands actually. So the glands of conjunctiva, the conjunctiva consists of two types of glands: the mucin secretory glands and the accessory lacrimal glands. So the epithelium consists of goblet cells, which produces mucin, like I have mentioned earlier. Along with that, near the tarsus, that is the eyelid, we have crypts of Henle, and also we have at the limbal area, at the limbal conjunctiva, we have the glands of Mann's. Okay, at the tarsus we have the crypts of Henle. So if this is the tarsus and this is the anterior portion, over here we have the crypts of Henle like this, and near the limbal area we have the glands of Mann's. Okay, if this is the pupil and this is the limbus, then here we have the glands of Mann's. Okay, and the accessory lacrimal glands include two glands, which are the glands of Cross and the glands of Wolfram. Okay, so that's about the anatomy of the conjunctiva.